The Government Communication and Information System and the South African Depression and Anxiety Group are currently hosting a webinar on destigmatizing men's mental health. This comes at a time when South Africa is facing a heightened rate of mental health cases where mental health conditions and emotional turmoil experienced by many lead to an increased rate of suicide. Psychiatrist Dr. Fran Korb and clinical psychologist Zamo Mbele are expected to unpack the topic of men's mental health. Let's take you there now.
Really a social problem that needs to be addressed by so many professionals, the public, government, everybody should be included. I don't know if anybody saw, but last night I actually read on News 24 a survey that's just been published where they looked at several countries, quite a lot of countries worldwide, in terms of what the country's mental state is. And South Africa came out the worst of all the countries all over the world that they surveyed in terms of the mental health of South Africans. I was just so shocked when I read that. I thought, sure, I mean, can we really be the worst in the world in terms of mental health? And I just think that is now just puts an absolute importance of what we are doing today. And hopefully this is the start of many interactions, many conversations around the topic of suicide, depression, mental health. There's just so much involved in terms of mental health. And I think the whole COVID that has hit us now almost exactly 2 years ago has really put another strain on what we're going through and what we're experiencing. So I'm really looking forward today to this conversation and discussion and getting everybody's views and ideas on what is happening and how they see the situation.
Thank you so much, Dr. Korb. And last but not least, we have a very important guest, because it's one thing to speak of a topic, but not necessarily have someone that can share with us their lived experience. And we are actually privileged this morning to have with us Chris de Bruin. Chris, welcome. And do you want to say a few words before we move on with the panel discussion?
Hi, good morning. I can't seem to share my video, my camera, but it is indeed a privilege to be able to share my story, to be able to share. I've committed myself to the cause of destigmatizing mental health in men, and really, it's such a blessing to be able to share my story because, like the previous two gentlemen have said, this is something that's not being discussed very often, and we have a lot of work to do as a country. And yeah, I'm excited.
Thank you so much, Chris, for that. And I'm going to move through and probably start with Dr. Franz Korb. Dr. Korb, I think before we even get into other questions, can you help us understand SADAG? What is their service offering? Because I think not many people are aware actually of the services that SADAG offers. And in the times that we are in, where we're trying to highlight and destigmatize men's mental health, we probably also need to raise awareness around what avenues are available to those who may seek that kind of support.
Yeah, I mean, I've been involved with SADAG since its inception, and that is, 28 years ago now. It was started by Zane Wilson. And it's really grown from those years where we only started as a kind of a support group for people with depression and anxiety. It started off really for anxiety, and then depression was added. And in later years, more things was added to what we were doing at SADAG. And it's really grown into an enormous organization, NGO. It is an NGO, so we are purely dependent on the public for funds to keep it running. I think we've got lots of projects, but one of the main functions that we do is we run helplines. And these are 24 helplines, 24 hours of the day, every day of the year. So anybody with mental illness can phone the helpline and get some help. And just to highlight what we're talking about today, before COVID, we were averaging about 400 to 600 calls per day. And since COVID started, our calls have now increased to over 2,000 calls per day. not a week or a month, per day, we're getting over 2,000 calls a day on the helpline. And also to say we are really the only helpline organization in the country where people can phone to get counselors, to speak to somebody, to get help with all their mental problems or what they're going through. That is kind of the main function, but then there are many other functions as well. We're information. People can go onto the website, get information about mental health, all the mental diseases. We've got outreach programs to far-off communities. We run the mental health days throughout the whole year. They do corporate information sessions. And then we've also got things, we've got a journal, Mental Health Matters for GPs, that we educate GPs and psychiatrists on mental health. We run lots of groups throughout the whole of South Africa. I can't even remember how many groups there are now. I think it's over 200 groups throughout of South Africa, support groups that meet monthly or twice a month, 2 weekly. There are just so many Facebook Fridays. There are just an enormous amount of things. But I think the main thing that we do is the helpline. And that is absolutely essential for what is happening in the country and the world at the moment. So it's the helpline is the main thing that we operate. And that's just in very brief.
No, absolutely. You've done a good job, actually, of helping us. I mean, even with the calls that you used to receive per day in comparison to post-COVID. We'll delve a little bit later on the impact that COVID has also brought with itself, how it has exacerbated the mental health issues. But before we get into other questions, I just want to bring in Zamo. Zamo, if you don't mind, we see of late that a lot of men, or maybe not a lot, but we are seeing we're seeing an improvement at least of men that are coming forward, to talk about their mental health issues, but we still have a lot of stigma, and in particular, within the Black communities, especially for men. Are you finding that with the numbers of calls that you receive, that is also reflected?
Yes, yeah. I mean, I'll actually start by responding to that, because I want to almost conversate it by adding to what Fran says. One of the reasons we've seen an increase in our calls is because of COVID, though one of the other reasons is because men and other people who would previously not access help are beginning to access help. And that's also because they're beginning to recognize that they need to access help. And thank you, for example, Chris, for being here, because you really are a real life example to very many other men to say that we need to be accessing help. In that regard, for example, Senzo, why does SADAG not take our calls? I'm coming to answer the question. Is coming from 400 to 2,400 actually, Franz, I checked the numbers, 2,400.
That's the latest.
That's the latest. We are struggling to catch up. It is a good thing that we need to catch up, because boy, do we need to catch up as a country in many ways. And even as an organization, we are struggling to catch up in many ways. I think the conversation around men and mental health or mental illness is such a beautiful one. And at the very same time, it's such a scary and complex one, because it's not as though men are only recently starting to struggle with mental difficulties or emotional difficulties. They're just starting to see that the expression of their difficulties is no longer functional to them or to society. It's no longer as socially acceptable, and thank goodness it is no longer as socially acceptable to be violent in order to deal with your depression, or to have a big temper or irritability in order to deal with your anxiety, or to drink excessively in order to deal with the combination of both, or to just spend copious amounts of hours at gym in order to deal with that. Instead, we're beginning to recognize that actually doing a lot of that was masking a lot of symptoms in many ways. I do think that answering a question, which is a big one around which population struggles the most, is so important. On the one hand, we do know that our Black communities perhaps have much less literacy and knowledge about what has gone wrong. So mental illness, psychiatric diagnosis, and psychological distress. And they certainly have had their limitations in terms of access, where to get help for it. However, what the statistics actually show is that mental illness is actually across board. And in fact, a lot of people will struggle with the stat that I'm about to share, they'll share it. The highest, or in terms of percentage and report, actually, white middle-aged men are still the biggest victims of suicide. And that's a multifactorial reason. Now, I'm not trying to foreground or background any population here. Instead, what I'm really trying to elevate and highlight is that it is all of our problem. And in the same way as our inside world has no color or gender, I think we have to, even from the outside, speak about it from that position, really knowing and saying that this is all of our problem and we all need to be moving forward together in this regard.
Yeah.
Thank you so much for that, Zamo.
I think Fran wants to add. Sorry.
Yeah.
Okay, once you can go.
I fully agree with Zamo. I mean, it's really the two main aspects. We've been trying to deal with stigma and mental illness for so many years. And I also believe that one of the main things is a lack of information, of people understanding what mental illness is all about. Or I almost want to say that we should stop saying it's a mental illness, it's just an illness, because we now know that there's lots of biological things. It's really an illness like any other disease. And by calling it mental illness, we say putting it in the stigmatizing block that we shouldn't really do. But I think education, whether it's in any community, because we know, and Zamo is so correct, that mental illness doesn't skip anybody. If it's males, females, whatever age you are, whatever education level, whatever financial status you're at, it doesn't matter. Mental illness affects everybody. So that's the first thing. And then our second thing that I fully agree with Zamo is access. We need to make to get help easy for people to go to, and people need to know where to go to, and they must go there and get help. So I think it's education, stigma, and access to me are the main things from my side that we need to really focus and really focus on and get right. Yeah.
All right. Yeah. I think Zamo and Dr. Korb, I'm going to come back to you, but I want you in the meantime to ponder around this input that's been made in one of the chat conversations here, that is government doing enough perhaps, to support our health infrastructure with the necessary skills for dealing specifically with mental health issues. But I want to bring in Chris to the conversation. Chris, as I've said, to have someone that can share with us their lived experience for that matter, it's a privilege, because not many people want to come out as a result of stigma that's attached to mental health. Can you perhaps share with us your journey with mental health, where it started, the kind of support? And I'd like you to also touch on, your family, because I think oftentimes as well, men are not able to freely come out because they are seen as the heads of the family. They're expected to be the stronger ones and not necessarily grapple with mental health issues. How has it been for you? But also, if you are employed, what kind of support did you receive from your employer in that?
Okay, thank you so much. So I've gone through pretty extensive trauma in my childhood. I was abused, I was bullied. I've gone through quite a lot. And the thing is, I was acting out. It really felt like Zamo was up there, that Zamo was talking directly to me, about that experience, because I used to throw tempers as a child, and people were just like, "Oh, it's just a boy." They never look at like why that sort of behavior happens. So the biggest thing for me is that I did not go for help because I didn't think that there was anything wrong. I didn't think that my behavior was dysfunctional. And to be honest with you, it was slowly killing me. I've been, I think I only started getting treatment at 30. I'm 37 now. And all of that time, I had an insane temper. I developed a drinking problem, substance abuse, abusing medication. I was struggling to hold down and be functional in a job because, I was having such terrible panic attacks that I was basically curled up on a toilet stall floor about 3-4 times a day, to a point where I couldn't breathe or move. And we never talk about it. Guys never talk about it. I think South Africa has a very patriarchal society, depending on what background you come from. Well, it doesn't matter what background you come from, whether it's religious, whether it's a societal thing, like you're prominent in the community or just a man. And even a lot of tribal norms is that the men are supposed to be strong. Things like aggression and being overly proud of yourself, it makes it very difficult to seek help and to acknowledge that you have a problem. So with me, I really hit rock bottom before I started getting help. I think it was maybe my 3rd or 4th suicide attempt where my family, that they knew about, but what was it on the 4th one, and they made an emergency appointment and helped me out financially to be able to go and see a psychiatrist. And yeah, basically it, and from there my journey started. I had a lot of rebuilding to do. And it's very difficult. In my last relationship, my ex, when I would have a depressive episode or when I was struggling to adjust to my medication, she saw that as weakness and she treated me differently because of it. I was treated as less than. And even with my journey and everything that I've gone through up to now, I'm very open about the fact that I am on medication, that I am seeking treatment. But when I'm going through those periods of lows and those periods of highs, and I still don't feel like there are many safe spaces to talk about it. Like at work, thankfully, I've got a fantastic job. I'm enjoying what I'm doing, and I'm actively working on my wellness by doing other things like making sure my eating is right, making sure my gut health is good, making sure that I'm working out. That I have a trainer. I've invested a lot in myself, but those things aren't accessible to everybody, which is disheartening. Whereas if the only thing that you know is you and your community and how you are supposed to behave, it's very difficult to seek help and to seek help and to normalize what you are going through. It's been one of the most difficult things. It takes work every day. You have to acknowledge your feelings, whether they're valid, whether you're paranoid, whether
well, there we have it. Studies have shown that the rate of suicides is higher amongst white males. But this statistic should concern all of us, as it affects all of us, regardless of race, social standing, financial position, even the level of education and so on. We had psychiatrist Dr. Fran Korb and clinical psychologist Zamo Mbele unpacking the topic of men's mental health, with guest speaker Chris Brain sharing his own personal account of living with mental illness as a male. Now, this webinar serves to sensitize the public about the importance of mental health and to explore the impact of toxic masculinity on the mental health of men, and to encourage men to open up and seek the necessary help.